My name is Charis Costopoulos. I'm an interventional cardiologist that I practice at Royal Papworth Hospital. Royal Papworth Hospital is one of the biggest cardiothoracic centres in the UK and is based in Cambridge. I practice both here and also have a private practice, active private practice in London. That's a great question. Since I was a child, I enjoyed interacting with people. I knew from a very young age that whatever profession I choose, it would be one that is very interactive and involves communicating both with a variety of people across different backgrounds. Of course, medicine does give you that opportunity because you interact with colleagues, first and foremost patients, and also other health professionals. So in essence, you get to experience and interact with people from different aspects of the society, which is something that I enjoy very much. At the same time, I was always very science-driven since I was a young child, and therefore, of course, medicine being a science-based profession allows to bring both those aspects together, interacting and connecting with people, and also dealing with science at the same time. Cardiology was my specialty of choice because it is based on physiology, and what I mean by that, it's based on understanding and trying to treat the way a body system works. So that was something I was always attracted to. At the same time, it is an interventional specialty. So I practice interventional cardiology along with general cardiology, and therefore you can treat patients' conditions with things like stents, valves, pacemakers fairly quickly, which can have a significant positive impact on the quality of a patient fairly instantaneously. So the main reason why I chose cardiology is because it combines both procedures, physiology, with at the same time being able to see a large number of patients in the clinic setting, which allows me to interact and speak to them. I grew up in Cyprus, which is a small island in the Mediterranean. I spent most of my time the capital of Cyprus, called Nicosia, or as we call it in Greek, Lefkosia. And I then moved to the UK when I got accepted at the University of Cambridge for my medical degree, and I have stayed here since. The most rewarding part about my job, it's a difficult question because there's so many aspects that I enjoy. I think certainly leaving work at the end of the day, feeling that I've done my best and I have helped my patients in the best way that I can. I think that is something that I find very satisfying. As an interventional cardiologist, one of the things that I do is the treatment of acute heart attacks, or STEMIs, ST elevation MIs, as we call them. And that's when the patients come as an emergency. And being able to open a vessel up in that setting, although I know that it has a significant impact and perhaps life-saving impact in patients. So from that point of view, I find that very rewarding. One of the other things I specialize in is the treatment of heart valves, including aortic valves in a keyhole manner in a procedure called TAVI. And in the older patients, when we treat this, that can have a massive and significant impact in the quality of life. So that is something that I find very rewarding. But just to finish, in essence, interacting with people, interacting with my patients, connecting with my patients, it is probably the most rewarding aspect of my job. What do patients appreciate most about me? I like to think that the qualities that appreciate most about me is the fact that I'm very approachable, I'm honest, truthful, and caring. I do not feel that they should think that they speak to a consultant cardiologist when they come and speak to me. They should treat me more like they are general practitioners, as it were. So I like to develop a relationship with my patients. So I think being approachable, down to earth, and spending time answering their questions, especially when it comes to explaining their conditions. I would hope that that is the qualities that my patients like about me the most.